Good morning, everybody. So I am a clinical pharmacist by training. I'm also a professor here at the Wegman School of Pharmacy. And since we are sitting here in this wonderful college campus, I thought it'd be a good idea to start today's talk with a little bit of a pop quiz. So the audience, you don't have to yell anything out, but please raise your hand if you feel you know the answers to the following questions. So we'll start with, what is a life-threatening side effect of taking too much acetaminophen? I see about half the hands up. How about, what drug class does the drug naproxen belong to? Only a few hands. Also, can you take naproxen at the same time as ibuprofen? I see a few hands. What is the potentially life-saving medication we give to somebody who's experiencing anaphylaxis? I see about maybe 2/3 of the hands up. And then finally, what medication can help reverse an opioid overdose? Again, I'd say about 75%. So you looked around and you saw who raised their hands. So now imagine you're a 16-year-old in the 10th grade. I can make the argument that 16-year-olds have not only just as much access to medications, but more access to medications than we do as adults. Because I can tell you that personally, I am not going through my parents' or my friend's parents' medicine cabinet looking for pills to take. And I also don't know where to go on the street to buy illicit medications. So for anybody who went to grade school between, let's say, the mid-1980s and the mid-2000s, you may have been exposed to the D.A.R.E program. So D.A.R.E stands for Drug Abuse Resistance Education. And what they did is they took local law enforcement and brought them into classrooms and tried to promote a 100% drug-free society. The problem with D.A.R.E is that there was a lot of data that came out in the mid-1990s that showed how ineffective it was. And we have a little bit of data to support that. So this is from the Monitoring the Future study from our friends at the University of Michigan. What they do is they survey upwards of 50,000 high school students every year on their tendencies of drug use and substance abuse. And so the red dots here indicate that upwards of 50% of 12th graders surveyed report that they have used at least one illegal drug in their lifetime. 50%, that's 1 out of every 2 seniors admit to using an illicit medication. Furthermore, the red dots here indicate that upwards of 80% of 12th graders can obtain these substances either fairly easily or very, very easily. So that's pretty much all of our high school seniors have access to these substances. So it's important for us to understand that and embrace this culture. What D.A.R.E did was they focused too much on the lecturing of not to do something. And they tried to arm students with skills and the confidence to remove themselves from situations, which is a great intention. But unfortunately, it shows that it wasn't very effective. So here, SpongeBob is saying one of my least favorite phrases in the English language, and that's, "because I said so." So I know we can all think back to when we were kids and our parents wanted us to do something that we didn't necessarily want us to do. And we gave every argument that we could. We thought we made a great argument, and all of a sudden they would shut down the conversation and say, "because I said so." Now I don't know about you, but that oftentimes made me feel a little bit jaded. I might have gotten angry at them. It might have actually pushed me in the opposite direction. And to that, a couple of D.A.R.E studies have actually shown that the D.A.R.E program, by just lecturing on not to do something and not saying why not to do it, can actually push students in the opposite direction. So what I like to focus on with my students in the classroom is to ask why 3 times. In my field, it's not enough just to know that something is the answer. We need to know why it's the answer. So if a student comes to me and says, "Dr. Zach, my patient is on the drug lisinopril," I would say, "Why are they on lisinopril?" They would most likely say, "because they have hypertension, also known as high blood pressure." And I would say, "Why did they pick lisinopril? There's literally 50 different medications you can use to treat high blood pressure. Why did they pick that one?" And then they would probably say, "Well, the guidelines recommend it, Dr. Zach." And I would say, "Why do the guidelines recommend it?" And then hopefully they come back at me and say, "Well, there are some studies that came out that show that in patients with diabetes, people who take lisinopril actually live longer. And my patient has diabetes and high blood pressure." Aha, there is the why. There is the reason why they chose this specific drug over the other 50 that they could have chosen. So I hope you can start incorporating that into your own lives. Don't just know that something's the answer, ask why 3 times. So I want students in middle school and high school to know that when you take too much acetaminophen, whether acutely or chronically, it could lead to life-threatening liver failure. And I want them to know that this can also happen by accident. How does this happen by accident? Acetaminophen is one of the most common medications that's out there. It's in a bunch of over-the-counter and prescription medications. If you're not careful and not reading the label about what you're putting into your body, over time, you can be getting more acetaminophen that your body can handle, and it can actually lead to some very severe liver failure. I want students to know that naproxen belongs to the class of NSAID, also known as a non-steroidal anti-inflammatory drug. Ibuprofen also belongs to the NSAID class, and taking both of them at the same time isn't going to do anything to improve your pain, but it's going to greatly increase the chance for serious side effects. With NSAIDs, we're worried about bleeding into your stomach. At best, this could lead to severe pain, and at worst, it can be deadly. I want students to know that epinephrine, oftentimes sold as an EpiPen, is what we give patients who are experiencing anaphylactic reaction. I also want students to know how to use it. I also want schools to be stocked with this, either in the nurse's office or in the principal's office, because those who suffer from very severe anaphylactic reactions and have very severe life-threatening allergies, they've all had their first reaction. And unless you've never had that reaction, you're not going to have epinephrine on your person. So we want that available in schools, and I would even argue in common public places, so when somebody starts having this first severe reaction, we can potentially save a life. I want students to know that naloxone, also known as Narcan, is the medication that we give to patients who are experiencing a heroin or other opioid overdose. I also want them to know that in the state of New York, there is a standing order that says anybody can go to a participating community pharmacy, and there's over 2,000 in the state of New York, and you can purchase Narcan without a prescription. So if you or one of your loved ones or friends uses opioids, then it would be a smart idea to have it on your person in case something bad were to happen. This could also help save a life. So here we have Mr. Mackey from South Park, who likes to tell us that drugs are bad, okay? It's not the best Mr. Mackey impression, but Mr. Mackey, it's not enough to know that drugs are bad. We need to know why they're bad. In fact, I want students to know that cannabis, in its pure form, most likely has some sort of medicinal properties to it. Problem is, we don't know how much to give, we don't know who to give it to, and we don't know how to give it, because it still remains a level 1, Schedule 1 controlled substance at the federal level, and it's near impossible to study. I also want them to be told repeatedly that the cannabis that they buy on the street most likely is not pure cannabis, most likely contains some very harmful and addictive substances, and it is never a good idea to put substances in your body that you don't know exactly where they came from. I want students in high school to know how heroin works in the body and the biochemistry of both mental and physical addiction. I want them to know how to use Narcan. And I want them to know that just because their friends tried something once and they were okay, does not mean that they can try the same thing and they'll be okay. Also, if they've tried something before once and they were okay, does not mean that you can do it again and be okay. You can become addicted or you can die the very first time you use any of these substances. So what should a medication education look like for today? So here's me. I'm in a local 8th grade health class, and I believe I'm explaining to this young man right here the concept of receptors and what happens when a drug molecule binds to a receptor. So I go into these classrooms for 5 straight days. The length is important because we were all in school before. We know what happens when you have a substitute teacher. It's almost like carte blanche to just mentally check out and not pay attention to what's going on. And we know that this topic is way too important for kids to start checking out. Not only am I giving them this education and this information on these substances, I want to answer the questions they have. And believe me, they have questions. So at the end of day 1 or 2, I might not get all the questions from them, but once they start building rapport with me on day 3 or 4, that's when all the questions start coming out. It's been a long time since I've been in high school, so I don't know exactly what's going on. I need them to tell me. One of the craziest questions I ever got from a student in 12th grade was, so you mean to tell me that when you're at a party and there's a bowl full of pills on the table that everybody's just taking from, that that's a bad idea? Yes, that is a bad idea for a number of reasons, and let me tell you why. I also want students to know what good mental health looks like. We're lucky enough to be in a society nowadays that is more and more welcoming of the concept of mental health and admitting that you need help. I want them to be exposed to the common neurotransmitters in the brain, serotonin, norepinephrine, and dopamine, and that just a slight imbalance in just one of those can lead somebody to feel sad or anxious, and that it's not their fault that they feel that way. Once you start taking the stigma off of feeling anxious or depressed, you empower students to come forward and say, I need help. And once you do that, they can stop living with a condition that they don't need to be living with. There's a lot of things, both using medications and not using medications, we can do to help with that. Better yet, we can potentially help them from hurting themselves or potentially others sometime in the future. So back to the pop quiz. What is the life-threatening effect of taking too much acetaminophen? It's liver failure. And we need to know that it can happen by accident also, because acetaminophen is in a variety of over-the-counter and prescription medications, and if you're not careful, over time, you can be taking too much and lead to some severe side effects. We should know that the drug naproxen is a non-steroidal anti-inflammatory drug, also known as an NSAID, and that you cannot take it at the same time as ibuprofen because it does not do anything for your pain control, but greatly increases the risk for serious side effects, namely bleeding into your stomach. Should you take ibuprofen at the same time? Of course not, because we just talked about that. What is a potentially life-saving medication that would give to someone experiencing anaphylaxis? It's epinephrine. Students should know how to give it. Teachers should know how to give it, and it should be stocked in classrooms and common public areas. And what is the medication that can help reverse an opioid overdose? It's naloxone, also known as Narcan. And we need to know that we can buy this from over 2,000 community pharmacies that participate in the program through a standing order without a prescription. So if you know somebody or you yourself are a user, to have this on your person can help save a life. So hopefully my talk today has gotten you thinking about your own knowledge about these medication and illicit substances, and has helped highlight how important it is to start arming our middle school and high school students with this knowledge. It's not enough anymore to say, to not do something. We need to give them the why. And if somebody still doesn't understand how important it is, just this one time I give you permission to say, because I said so. Thank you very much.